So, speaking of the C suite, something that's important is resource allocation. So, there's probably a balance that you have to strike or a flow with allocating resources, meaning time and money towards safety initiatives. How can you speak to that?
Our experience was a 5.5 years running a big organization with 360,000 people, 4,000 employees, and 1,000 contractors. And what we began with basically was the need of clear, compassionate communication so that people realize that the first step is to talk to each other and to the patient nicely and trying to understand what the other person needed and what the other person was saying. If you start with that, it is a giant step towards safety.
And as soon as we implemented that, in fact, engagement went up yearly with the staff, but it also changed the satisfaction level of the patients and the family members. And every year you saw an enormous improvement. And even within teams and departments, you saw people that, while they may have had perfect results, did not love their team and their leader. And in the end, when they all learned to be less controlling and more compassionate and more empowering of those around them, they all ended up having an engagement that skyrocketed. And they went from being on the lower 1/3 of departments to the highest 1/3.
And this is to say that basically the investment is not really an investment in people dealing with the safety. It is an investment in your effort to make sure that everybody feels like they can talk in this organization, they belong, and they're really appreciated. What happened is that for 5 years, the safety increased every year by documenting the number of incidents that occur. The engagement improved every year, the efficiency increased, and at the end of the year, we save 1% of the budget to 1.5 billion without really attempting to save the money. So we saved the money, we had a stronger organization, and the safety had increased. So I feel like, the recipe is fairly simple, but actually implementing requires a lot of effort, particularly, again, by the part of the leadership. They need to take the responsibility to lead the group and make sure that everybody understands that what they're doing is for the benefit of the patient and for the benefit of everybody else in that workplace.
And one thing that we instituted, because we wanted everybody to be able to collaborate across departments as well as within their own department, is that when we did these trainings, we didn't just do it for one department at a time, unless there was something specific to that one department. But for communication and compassion training, we actually had people from different parts of the organization at the same time, some of them without clinical specialties per se, and they would say, well, why do I need to be there? Until they suddenly realized why, for their own health and for how they influence what happens. Because if they make policies and software and things like that that are difficult for the staff to use, then they are undermining the safety and the success of the organization.